coming week is lymphoma week. So what I was planning is to discuss with our audience regarding what is exactly lymphoma, because it is a quite common malignancy as far as hematological malignancies are concerned. I would say second to third in the list. So what is lymphoma? So you have lymph nodes, which are glands which drain a particular area. So their primary function is to build up immunity. As you know, whenever you have some infection at on the great toe, your lymph glands in the inguinal region swell up. So their function is to control the infection, but at times they turn into means the lymph nodes or the lymphocytes inside the lymph nodes turn into malignancy. That is called as lymphoma. Broadly speaking, lymphoma can be divided into two parts. One is Hodgkin's lymphoma and the other is non-Hodgkin's lymphoma. Then there is further division in Hodgkin's lymphoma. We need not go into further detailing. Non-Hodgkin's lymphoma also, it is of broadly two types. One is B type and another is T type. B type is called as diffuse large B cell lymphoma, whereas T type consists of T lymphoblastic lymphoma and peripheral T cell lymphoma and so on. Now the next thing, how do they present? So what caution the patient should take when you should suspect that the patient is having lymphoma? One, weight loss. The patient might be having weight loss, night sweats, at times loss of appetite, and clinically also, or when the patient is having bath, he might feel that there are some lymph glands in the cervical region or axillary region or inguinal region. So asymptomatic lymph glands. So any of these symptoms patient notices, he should immediately see the local physician, or if he has an access, he should see directly hematologist. So how do you evaluate a case of lymphoma? So you are suspecting a patient to have lymphoma. How do you evaluate him, or how do you work him up? So first thing is that you should have tissue diagnosis. How do you get a tissue diagnosis? You should never go for FNAC, that is fine needle aspiration cytology. Though it might give you a clue whether it is lymphoma or not a lymphoma, but for subclassification, you need a tissue. Always you should go for a lymph node biopsy, and it should be a true cut lymph node biopsy or total excision of the lymph node, so that if needed, you can do immunohistochemistry on that lymph node. So now you have done excisional biopsy and morphology is consistent with lymphoma. The next step is you should do immunohistochemistry on that lymph node tissue. So that will help you to classify the lymphoma into non-Hodgkin's and Hodgkin's lymphoma. Now we have established that it is lymphoma. As an example, we take this lymphoma as diffuse large B-cell lymphoma. So how do you work further? So what you do is that you do a bone marrow biopsy to assess whether lymphomatous involvement is there in the bone marrow. At the same time, you also do certain biochemical tests like LDH, liver function test, creatinine, that will give you whether this lymphoma is having some impact on liver function or renal function, and accordingly you can take further steps. The most important step in evaluation of lymphoma is you should do PET CT scan. That will help you to you can palpate certain lymph nodes or certain parts of the patient's body, but you are unable to access the regions where you cannot palpate the lymphomatous deposit. PET CT scan will give you an idea which all regions are involved, and it will also help you later on to know whether the patient has responded to particular chemotherapy. So we have completed the whole evaluation now. Now how do you treat? So diffuse large B-cell lymphoma, which is the commonest non-Hodgkin's lymphoma, has very good outcome. Initially in 80s and 90s, the treatment of choice was CHOP chemotherapy, which had a outcome of roughly 50 to 60%. But in 2005, there came a new drug called as rituximab. which is a monoclonal antibody. It is an antibody which is directed against CD20. CD20 is an antigen which is expressed on lymphomatous cells. So what rituximab does is it directly targets this CD20 antibody, and thus it brings about a targeted therapy approach. So the standard of care for diffuse large B-cell lymphoma is R-CHOP chemotherapy. You club rituximab with CHOP chemotherapy, and this is the chemotherapy which we give in the diffuse large B-cell lymphoma, and it is given at 3 weeks duration. So one chemotherapy, if it is given today, after 3 weeks you give the second, and another 3 weeks later you give third chemotherapy. After 3 cycles you reassess. If bone marrow is involved at presentation, you repeat bone marrow. PET you repeat, because you need to assess how the lymphoma has responded to your chemotherapy. If the response is complete remission, that is no lymphomatous involvement, then you give another 3 cycles. If the disease has progressed, that is new lymph node sites have occurred or new sites have been involved by lymphoma, then you need to change the chemotherapy. So you have completed 6 cycles now. After 3 you have achieved remission, another 3 you give, and then again repeat PET CT scan. If after 6 cycles, if the PET is negative, then how do you follow up this patient? There is no need of repeating PET CT scan during each follow up. You can just do the physician or the hematologist who is looking after this patient can examine this patient thoroughly, look for any new lymph nodes during follow up, and certain simple blood tests like complete blood count and lactate dehydrogenase that will give you an idea whether the disease is relapsing. Initially for 1 year you follow this patient every 3 monthly, and then you follow this patient 6 monthly for another 2 years, and then finally once a year for next 2 years. If the lymphoma doesn't recur within first 5 years, then the chances of relapse are very less. This was about the commonest non-Hodgkin's lymphoma which we discussed. Now we will discuss a young boy, 16 years old, who presented with just neck swelling, and he didn't have any fever, weight loss, loss of appetite. So it was a huge mass in the neck, measuring about 5 centimeters in diameter. How do you approach? So what would be the differentials here? Clinically, it could be tuberculosis, but there are no B symptoms. Second differential would be some infection other than tuberculosis, or it could be lymphoma. The only way to differentiate infectious cause from non-infectious causes would be to do a lymph node biopsy of this neck mass. We did a lymph node biopsy of this neck mass, and it turned out to be Hodgkin's lymphoma, classical Hodgkin's lymphoma. So how do you go about it? So as I said, there was only cervical swelling, no inguinal swellings or axillary swellings. So we did a bone marrow for this patient. Bone marrow was clear. Did a PET CT scan to assess the extent of disease. That it was localized to only the neck region. Detailed counseling was done regarding the disease and the treatment which we are going to give. And then the patient was started on ABVD, which is a standard chemotherapy regimen used for this Hodgkin's lymphoma. It constitutes adriamycin, bleomycin, vinblastine, and dacarbazine. These are the 4 drugs which we use. We gave, the plan was, as it was localized, to give 4 cycles, that is 8 doses of ABVD. And after 8 doses of ABVD, we would assess. So we gave 8 doses of ABVD, that is 4 cycles of ABVD. And then after giving 4 cycles of ABVD, we reassess the disease, did PET CT scan that showed complete resolution. And initially the PET CT scan showed a mass of diameter of 8 centimeters, 8 to 9 centimeters. That's why post chemotherapy we gave him radiation so that the disease will be under check. And as you know, Hodgkin's, now the patient is almost 5 years post chemotherapy. He is doing well. Hodgkin's lymphoma, especially the localized types, have a very good outcome. Almost 80% of the patients have sustained response. Why I discussed these 2 cases was that in olden days there was a misconception that once you are diagnosed with some malignancy, whether it be solid tumor or hematological malignancy, it is the end of the road. You don't make it. But with advent of newer drugs like rituximab and good screening as well as follow-up modalities, the outcomes are very good. If they are picked up at early stages, then the outcomes go in the range of 80% to 90%. So that is very important, that you are diagnosed with lymphoma. That doesn't mean that it is end of the road. It is just a hurdle which you can cross. And with various biologicals which are marketed by local companies, the outcomes have revolutionized. So diffuse large B-cell lymphoma, which is localized, has a outcome of approximately 80%. Even Hodgkin's lymphoma, classical Hodgkin's lymphoma, like in our case, has an outcome of about 80%. So lymphoma diagnosis is not end of the road. It is just a hurdle which you need to cross, and then the road further is like a runway. This was about lymphoma. So what I would like to highlight for the audience is that what should prompt you that you should evaluate a particular symptom of yours for lymphoma. One is lymph glands in the neck, axilla or inguinal region. Any fever which is not getting resolved in spite of standard therapy. You are having loss of appetite, loss of weight, significant loss of weight, that is something like 10 kg in 2 months. You get night sweats, you are sleeping and suddenly you are drenched with sweat. That should prompt you that something is wrong. You should immediately report to local physician who will evaluate you further and take you in the direction so that early diagnosis is done and the curative options are explored upfront. So I would conclude my small talk here, and what I would advise the audience would be you should be aware of lymphoma and you should not be frightened because of lymphoma. You should take steps to reach a diagnosis at the earliest. And what I always tell my patients is you should be always positive. Whenever lymphoma diagnosis is done, you should be positive. You should think that you are going to conquer this lymphoma. The more positive you are, the better the outcomes are. That's very simple, because it's you need to be very positive as far as mind setup is goes, and you should report at the earliest when the symptoms which I have enlisted are seen in any of your family members, like cervical swelling, wet loss, loss of appetite, or drenching night sweats. So early diagnosis and early treatment will help us in conquering this disease. Thank you.